Hello everyone, welcome back. In today's session we are going to study about epilepsy. So what is epilepsy? It is basically seizures are an abnormal sudden excessive discharge of electrical activity within the neuron of brain. Okay, so we know, right, there is already present electrical activity in our brain. Because of that we are responding to internal world as well as external world. Okay, because suppose you are touching a hot object, something is on your oven and you are touching that, okay, and within fraction of second that your brain is signaling you that this is hot object and it may burn your hand, so remove it. Okay, before you actually realize your this signal or electrical activity make the response. Clear? So you are removing your hand and saving yourself. Clear? So this is normal electrical activity, but in seizure what is happening? It is abnormal sudden excessive discharge of electrical activity. Because of that in seizure you will be seeing rigidity will be there present, there will be jerking movement. Okay, because it is kind of sudden things, it is not giving sometimes prior any signal also, so that's why it is kind of abnormal sudden excessive discharge of electrical activity within neuron of our brain. Clear? And chronic seizure activity called epilepsy. So what is epilepsy? That is same things when seizure is in chronic month. Okay, so basically on the basis of duration it is called chronic or acute. Clear? Now coming to etiology. What all are the etiology? That is, first one is brain tumor, that is the most common cause. Second is toxins, hyperpyrexia and cerebral hypoxia. Clear? Then birth injury. What is that? Like while delivering the baby, okay, there maybe some forceps is hurting the baby's head, or sometimes that baby is delivered too quickly that the nurse, sometimes it sleeps also, that baby has fallen during the delivery. So all this can be cause of birth injury. Clear? Now idiopathic क्या है? First attack of epilepsy before 20 years of life. Idiopathic मतलब we don't know the reason, we don't know the cause. Now congenital defect of CNS, that is most common cause of epilepsy into children. Clear? Now coming to head trauma, within 1 year from head injury, infection, that is meningitis, encephalitis, inborn error of metabolism, that all will be the etiology. Clear? Now types of epilepsy में क्या है? First is generalized seizure. Generalized seizures result from excessive electrical discharge from both hemispheres of the brain. Okay, generalized में क्या है? Both hemispheres will be involved here. Clear? The most common types of generalized seizures are tonic-clonic seizure. This is also seen in ECT. Okay, when we are giving electroconvulsive therapy, we will be discussing in psychiatric nursing. So there also this tonic-clonic seizure is present. What is tonic? Tonic means basically toned. You can remember like toned because that whole body will be rigid. Okay, and what is clonic? That is jerking movement. Okay, that we will be discussing in separate class. Now for now we can study about what are the types of generalized seizure. That is, first one is tonic-clonic seizure, also called grand mal seizure, and these types of seizures have 3 phases. What is that? That is aura. Signals of an approaching seizure like irritability, restlessness, hallucination and insomnia. So this is basically first signal. This time they are giving signal, right? Aura means signals of an approaching seizures. Okay, patient will feel irritable, irritated feel करेगा, वो restless हो जाएगा, hallucination आएगा and insomnia. ठीक है? Now tonic में क्या है? Stiffness of the muscle of arm and legs about 10 to 20 seconds and loss of consciousness. As I have already told, that patient will feel rigid. Rigid and stiffness both are same. So, and it will continue up to 10 to 20 seconds. Okay, and here patient will lose his consciousness or her consciousness. ठीक है? Now clonic में क्या है? Jerking of extremities last about 30 to 40 seconds. Okay, so total 3 phases there. Phases are there. See, aura, tonic and clonic. Hope it is clear. Now pipitmal or absent seizure, what is that? That is brief period of altered consciousness lasting 5 to 30 seconds usually in childhood. मतलब क्या है, तुम्हें पता ही नहीं चलेगा अगर बच्चे का सीजर आ रहा है ना, तो भी तुम्हें पता नहीं चलेगा कि उसको वो सीजर में है, ठीक है. So that is called absent seizure. Clear? The patient, typically a child, shows a blank facial expression that may be followed by movements such as repeated eye blinking or rolling and lip smacking. Can you imagine? Like this is basically, you may think that baby is doing it normally, but it is not normal. If baby is doing like repeated eye blinking and rolling of eyes, then lip smacking, okay? So all these are the symptoms of absent seizure, okay? There will not be any jerking movement, no rigidity will be present, just blinking of eyes, and that is also only for 5 to 30 seconds, okay? Hope it is clear. Next one is myoclonic or minor motor seizure. What is that? That is brief generalized jerking or stiffening of extremities. ठीक है, सारे जो jerking and stiffening of the extremities, that will be for a very short period. And last one, that is atonic or akinetic, that is drop attack seizure, that is a sudden momentary loss of muscle tone, that is victim may fall. मतलब क्या है, अचानक से कोई गिर गया है ना, basically that means अचानक से कोई गिर गया. See, a sudden momentary loss of muscle tone and victim may fall. Hope it is clear. The next part is partial seizure or focal epilepsy. What is that? It begins with focal or local discharge of one part of the brain. In generalized, we have seen that both hemispheres are involved, but in partial seizure, only a focal or local discharge of one part of brain is involved. Okay? The most common types of partial seizures are simple partial. What is that? When a patient remains awakened during a seizure episode and the seizure is said to be simple partial. And Jacksonian seizure, what is that? Sometimes called March seizure. It is a type of simple partial seizure. Okay? So Jacksonian seizure में क्या है? It is also called March seizure and it is a type of simple partial seizure. The classic march begins in thumb and progress up to the arm. Clear? So this is simple partial and next is complex partial. What is that? Psychomotor seizure. Most commonly involved area is temporal lobe. You can remember that complex partial में temporal lobe is involved. It is characterized by period of altered behavior about which the client is unaware and activities like lip smacking, picking of clothes and chewing etc. ठीक है, कभी कभार क्या है, पेशेंट को खुद को ही पता नहीं चलता है उधर क्या था, उधर वो बच्चा था इसलिए उसको तो नहीं पता, वो बस क्या कर रहे थे, लिप स्मैकिंग कर रहे थे, आई रोलिंग कर रहे थे, आई ब्लिंकिंग कर रहे थे. अभी इधर क्या है, एडल्ट को भी पता नहीं चल रहा है. इट इज अ characterized by period of altered behavior about which the client is unaware and activities like lip smacking, picking of clothes and chewing. मतलब क्या है, समथिंग इनवॉलेंट्री मूवमेंट हो रहा है. मतलब ऐसे तो नॉर्मली होता है ना, च्यूइंग मूवमेंट इज आवर वॉलेंटरी मूवमेंट, बट दैट विल बी इनवॉलेंट्री समटाइम्स. द पेशेंट विल नॉट बी समटाइम्स रियलाइज दैट ऑल दिस आर हैपनिंग. होप इट इज क्लियर. जनरलाइज्ड एंड पार्शियल. नाउ नेक्स्ट इज व्हाट आर द कॉम्प्लिकेशन. फर्स्ट वन इज स्टेटस एपिलेप्टिकस. व्हाट इज दैट? कंटिन्यूअस सीजर एक्टिविटी विदाउट पॉज. ठीक है, सो स्टेटस एपिलेप्टिकस में क्या दिखेगा? कंटिन्यूअस सीजर एक्टिविटी. ठीक है, कोई पॉज नहीं है इन बिटवीन. इट इंक्लूड्स टू बैक सीजर्स विदाउट अ ल्यूसिड इंटरवल और विदाउट ब्रीफ रिमिशन ऑफ सिम्टम्स और एंड सीजर और एनी सीजर लास्टिंग मोर देन 5 to 10 minutes. ठीक है, अगर सोच लो कि ऐसा जार्किंग वाला मूवमेंट किसी को 5 to 10 minutes हो रहा है, मतलब कितना डिस्ट्रेसिंग है ये वाला, है ना. So that now administer sedatives like diazepam. In this case, we are giving sedatives to the victim or patient. ठीक है. Now diagnosis क्या है? Abnormal electroencephalogram. We are doing EEG here. And management में क्या है? Protect the patient from injury. If the patient is standing, place on the floor, or if on bed, put side rails. ठीक है? Because we have to save the patient. That's why we are going to protect the patient. If the patient is lying on bed, what we are doing? We can put on the bed rails so that that patient can't fall. Clear? And if patient is standing, then we are making him lying on the floor. Hope it is clear. Now maintain a patient airway and do not force the jaw to open. Then maybe that fracture can happen. Okay, if you are doing like while patient is jerking and you are trying to open the jaw, then that will be also distressful for the patient, and he or she will be more excited. So don't do that. Okay. Now administer IV anticonvulsant, that is anti-seizure medication. It acts by stabilizing nerve cell membrane and preventing spread of epileptic discharge to adjacent neurons. So now we are giving anticonvulsant medication. And what all are the examples? That is valproic acid, phenytoin sodium, then carbamazepine, divalproex, then gabapentin, phenobarbital sodium, and many more. Okay. According to the age category, according to the condition, like acute or chronic. So all these condition we will be keeping in mind, and we are going to give this medication. See, common side effects are gingival hyperplasia, blurred vision, nystagmus, hyperglycemia, and blood dyscrasias. Okay, low platelet and WBC count. It is called blood dyscrasias. Okay. Now phenytoin mixed with NS only, not with the dextrose. Okay. So we have to mix the phenytoin with normal saline, not with the dextrose. And if patient is taking phenytoin, it is reducing, it has reducing effect of birth control pill, and also has teratogenic effect if taken during pregnancy. So we have to give this medication cautiously to the pregnant mother. We are not giving this medicine to pregnant mother, and also who all are taking birth control pill, then also we have to maintain the dose. ठीक है, क्योंकि ये उसका एफेक्ट भी कम कर देगा. क्लियर? नाउ केयरफुली ऑब्जर्व एंड रिकॉर्ड डिटेल्स ऑफ इवेंट्स ड्यूरिंग सीजर. जब सीजर हो रहे तब मतलब हमें वो उसको ऑब्जर्व करना है कि क्या क्या उसका रिएक्शन है, पीरियड कितना हुआ, मतलब टाइम इंटरवल कितना था, या उसके लिए कुछ उसके बाद पेशेंट का कुछ है, लाइक सर्टेन पीरियड ऑफ लॉस ऑफ कॉन्शियसनेस इज देयर, या लिप स्मैकिंग वाज देयर, या क्या क्या मूवमेंट था, सब कुछ हम रिकॉर्ड करेंगे. ठीक है, टाइमिंग क्या है, या कितना बार आ रहा है एक दिन में, अगर विद इन 24 आवर्स हाउ मेनी टाइम्स इट इज कमिंग. ठीक है. देन सक्शन फ्लूइड फॉर द एयरवे क्लियरेंस. ठीक है. नाउ वी आर डूइंग सक्शनिंग टू क्लियर द एयरवे. नाउ रिमेन with patient and do not restrain. We are not going to restrain the patient when that patient is supposed to have seizure. Clear? Now instruct the client about importance of lifelong medicine. All these patients basically they get dependent on the anticonvulsant medicine. So we have to instruct the patient that not to self dose. Like कभी कभार क्या होता है ना, पेशेंट खुद से ही मेडिसिन ये कर लेता है, डोज को चेंज कर लेता है, लेकिन वी हैव टू टेल द पेशेंट नॉट टू डू दैट, एंड दे हैव टू स्टिक टू द मेडिसिन, एंड विदाउट डॉक्टर्स प्रिस्क्रिप्शन दे शुड नॉट डू एनीथिंग एंड नॉट टू स्टॉप द मेडिसिन, अदरवाइज दैट विल कम अगेन एंड इन सीवियर कंडीशन maybe. ठीक है. Then turn the client's head to the side so that no aspiration can happen. Then loose restrictive tight clothing and sometimes surgery to remove epileptic focus. Clear? So basic things you have to remember when you are writing nursing management or management. So what we are doing from the first, see, if patient is on bed, we are giving side rails, and if patient is standing, then we are making him to lie on floor. Now what we are doing? We have to maintain the patent airway, and if patient is wearing tight clothes, we have to loosen them. ठीक है? Then क्या है? We are not supposed to do any force. Okay? Don't force to open the jaw. Clear? Then we have to give medicine as per the medication and what all are the doctors are prescribing. Next क्या है? We have to carefully see the drug and the age category. As I have already told, that pregnant lady, child, male, female, whatever it is, we have to keep in mind the basic rules and cautiously we have to give. And common side effects also we have to tell the patient, and not to do the self-administering the drug and not to adjust dose by self. Without doctor's prescription, he or she should not do anything. Okay? And not to stop the medicine until doctors are prescribing. Then what we are doing? We should not restrain the patient. And after मान लो कोई सीजर एपिसोड हो गया है, to maintain airway clearance we are doing suctioning, and पेशेंट्स का जो हेड है उसको हम साइड में कर देते हैं ताकि कोई एस्पिरेशन ना हो. And next, sometimes surgery to remove epileptic focus. Hope it is clear. All these points are very important. And diagnostic मतलब diagnostic intervention में क्या कर रहे हैं हम? That is abnormal electroencephalogram. Next, complication में status epilepticus and all these types, generalized, partial, all these are very important, and etiology as well. So hope this epilepsy part is clear to all of you, and still if it is any doubt is there, this is basically a brief important points of epilepsy. ठीक है? इसके हिसाब से तुम लिख सकते हो एग्जाम में भी. So keep studying and happy learning. Thank you so much for listening me.